Welcome back, everyone. Today we're going to talk about healthy coping. Up to 80% of people with diabetes experience diabetes-related distress at the time of diagnosis. But they were never asked how they felt and obviously never told how to deal with these feelings and thoughts. Up to 45% with people with diabetes experience diabetes-related distress at some point in their lives with diabetes. Why is it super important to talk about diabetes stress? Because it has a very strong impact on your blood sugar, your A1C, and diabetes care overall. One way to deal with stress is to eliminate the stressor. But if we can't, in case of diabetes, at least for now, we need to learn how to deal with it. This is called coping. We are going to learn about some healthy coping skills to motivate you in diabetes care. Hi everyone, my name is Haney Jarris. I'm a board-certified clinical pharmacist and a diabetes care and education specialist. I'm here to present you with proven diabetes self-management and education support in order to empower you to best manage your diabetes through the knowledge and the skills that you may acquire here. The contents of my video are based on the framework of the Association of Diabetes Care and Education Specialists, as well as the American Diabetes Association. The link for both organizations, as well as any references that I'm going to mention in these sessions, are in the description box below. And this video is not sponsored by or paid for by anyone. Healthy coping is having a positive attitude towards diabetes and being actively involved in diabetes self-management that is centered around you. It means maintaining a healthy relationship with people and being able to use activity to improve your quality of life. Why healthy coping is important? It's important because it lowers the release of the stress hormones in response to these stressful situations. By the end of this session, you should be able to learn 3 facts. Number 1, know that managing diabetes requires flexibility. Number 2, know the symptoms of psychological problems like depression and anxiety. Number 3, know the benefits of healthy coping in dealing with these issues. Using the knowledge that you should then be able to figure out any diabetes-related stress you experience, so you feel motivated in applying coping skills that we will learn to deal with these stresses. Diabetes impact our lives. The DAWN 2 study, which is the Diabetes Attitude, Wishes and Needs, showed that diabetes has a negative impact on our physical health, but also it has a negative impact on our emotional health. The study showed that some people with diabetes have a bleak outlook on their future. When you have diabetes, you will need to make certain changes that could be stressful for you. Changes in eating habits, taking medications, monitoring your blood sugar, exercising, and constantly thinking about what could happen in the future as a complication of diabetes. What are your thoughts and feelings about living with diabetes? How did you feel about diabetes when you were first diagnosed? And how do you feel about diabetes now? Do you believe that diabetes is a condition that can be managed, let alone treated, and completely reversed? Do you think that all this effort that you're putting into diabetes management is worth it? What is the hardest thing for you about living with diabetes? Do you have any friends or relatives with bad experiences with diabetes and you are terrified that you will experience the same thing? It's very normal to have all these feelings and thoughts. You may have more than one of these feelings. They are not a sign of weakness. Also know that these feelings and thoughts will change over time. They can even vary from one day to another. One common feeling is shock or denial. Is it really happening to me? Anger and resentment. Why me? Some people feel angry about having diabetes. Simply they feel it's a lifelong journey of restriction. You may feel that your own body betrayed you, especially if you have been doing the right things all along. This sometimes can be expressed as anger towards other people. Sadness and worry. Sadness about diabetes is a very common response. Thinking that diabetes management is overwhelming and its complication could be devastating for health. Fear of long-term complications of diabetes. The feelings of sadness and worry are okay and very common. Feeling of guilt and self-blame. Sometimes you believe that you did it yourself. Maybe you were warned by your team that you have prediabetes and you need to lose some weight or exercise, but you didn't. If you have diabetes complications such as nerve pain, kidney failure, stroke, you may feel guilty that you did not do enough to manage your diabetes and prevent these complications from happening. Now, what is diabetes distress? It is some combination of the feelings that we just mentioned. Diabetes distress is a combination of emotional burdens and worries that are related to the experience of living with diabetes. It is sometimes misdiagnosed as depression. It causes frustration with diabetes management, and people experience fears around potential complication, erratic blood glucose that's too high or too low. The signs of diabetes distress also include worry. Worrying about balancing diabetes care with your other responsibilities. Tons of them. Actually knowing that other family members are stressed out that you have diabetes and are always worried about you, and being the diabetes police. This could be a source of diabetes distress in itself. Don't blame yourself. You cannot change what has already happened, but you can learn from it. You need to focus now on what you could do to manage your diabetes. The good news is diabetes is manageable and it's treatable. Yes, we can achieve diabetes remission if we are empowered and motivated enough. It's no secret. Losing weight is the key. And it doesn't matter if you were just diagnosed or you have advanced diabetes. If you have advanced diabetes, you may just need to lose a little bit more extra weight. We see here that we start to see a diabetes remission after weight loss of 10 to 15%. If you have diabetes less than 6 years. If you have advanced diabetes, you can achieve remission with weight loss of 20 to 25%. Yes, diabetes is treatable. Share these thoughts with someone you trust. Let it out in the open. Speak with your care team about it so we can address these thoughts before they progress into clinical depression or anxiety. And we are going to review some proven tips and strategy to help you deal with these feelings. So how do you know if you have a diabetes distress? Well, there is the Behavior Diabetes Institution. They do have a diabetes distress scale where you can navigate to their website and then you can click on the questionnaires that you will need to answer these 17 questions. And then at the end of the 17 questions, it will be a simple math calculations where you will divide the sum of the 17 items by 17s and it will give you a score. And based on that score, will determine if it's mild, moderate, or high. So what is the difference between diabetes distress and depression? Depression is more than just feeling down when things are not going well. Feeling sad, depressed, down, or blue for at least 2 weeks. Loss of interest or pleasure in things that you were previously enjoying for 2 weeks or more. Mood or lack of motivation that interfered with management of your diabetes. This is the definition of depression. We also have to understand that depression and diabetes have a bidirectional relationship, which means that having diabetes increases your risk of having depression, and having depression increases your risk of having diabetes. 2011 study found that 13% of people with diabetes have major depression, and 20% have less severe but clinically significant depressive disorder. If you have diabetes, your risk of having clinical depression doubled or tripled. Untreated depression makes management diabetes a lot harder than it is already. So how about anxiety? Anxiety is excessive worry, whether it's about a specific thing or a general feeling, especially if it comes with restlessness, difficulty concentrating, poor memory, sweating, shaking. So is it an anxiety or is it a low blood glucose? The symptoms of an anxiety feels like a low blood glucose. If these symptoms only happen during low blood glucose level, an anxiety may not be the issue cause. But if you have symptoms outside of the low blood glucose, you need to let your care team know because it's probably an anxiety. If you have depression or an anxiety, you need a referral to a healthcare professional. Cognition. It's so important to talk about cognitive impairment, which is the decline in our memory and thinking ability, because any impairment to our ability to focus, understand, remember information can affect our ability to manage our diabetes. Actually, poor controlled blood sugar may increase the risk of developing Alzheimer's. This relationship is so strong that some have called Alzheimer's diabetes of the brain, or type 3 diabetes. A very sensitive questionnaire, St. Louis University Mental, can be very useful in assessing cognition. Slum Mental Status Exam is available on the website of the St. Louis University. You can go in and download the actual questionnaire, and based on the questionnaire over here, it will give you the scoring, whether it's normal, mild, cognitive behaviors, or dementia, depends on the score that you got. We're going to review some healthy coping skills and strategy. These skills are problem solving, cost-benefit analysis, obtaining support, relapse prevention, and stress management. Skill number 1, problem solving. When we talk about problem solving, we talk about multiple steps. The first step is describing the problem. Like, I keep forgetting to take my evening medication. Step number 2, describe what is the chain of events that result into the problem. Well, I forget to take my medicine and I decided not to test my blood sugar this evening because it is going to be high anyway. Why bother? Negative thoughts to lead negative action. Less monitoring this evening will lead to less monitoring tomorrow, and so forth. Step number 3, describe a behavior that you were able to change, actively pursuing more positive thoughts. Like, well, at least I'm watching my food portions. I haven't gained any weight since I started paying attention to my diet. Step number 4, describe a solution to that problem. Well, we can place the bottle of the medications where the dinner is always eaten. Maybe we can set the cell phone alarm for 5 p.m. Maybe you can buy a medicine reminder from the pharmacy. Maybe you can place a note in the kitchen as a reminder. Skill number 2, motivation skills. Cost versus benefit analysis. A common phrase that we usually get all the time, I'm just not motivated enough. Motivation is what drives us from the inside to do what needs to be done. What's one thing you find hard for you to do in taking care of your diabetes? If it involves a change to your normal routine or includes more physical activity or going to the gym or watching your diet, you need to be honest with yourself in answering some questions. And we can put these questions and answers in a table. What do I have to do to make this change? What will happen if I just don't make this change? What is in it for me? And we place it on the table, cost versus benefit. Let's take diet change or diet restriction or eating healthy. We can put the cost and we'll put the benefit. The cost could be restrictions of diet, inconvenience, can't eat what I like, but the benefits of it could be blood sugar more controlled, less complications in the future, feeling energetic, better memory, better healthcare overall. And then you decide to yourself. Skill number 3, relapse prevention. Slips up happen. Everyone slips up. Describe a situation that causes you to slip up with your diabetes self-care. What were your thoughts? Any triggers, and how did you deal with it to get back on track? There are things people can do to help deal with lapses and prevent them from becoming a full-blown relapse. Let's have a look at this situation. Mrs. Rodriguez is a 58 years old woman with diabetes on a metformin and Actos. Her doctor told her, well, in addition to exercise, if you eat healthy, you may end up losing weight and you may not need medications to manage your blood sugar anymore. But she's a cook in the house and no one wants to follow that healthy diet that she wanted to follow. She has no support from family. So maybe she can come up with some solution. Maybe she can cook the same meals for all the family member and limit her portions. Maybe she can ask family member to cook their own food and start taking some responsibility. Or maybe start making changes in the way that she prepares food and see if anybody will notice. Using the I statement is very helpful, like, I need help staying with my meal plan. Is it really hard for me to avoid snack food when there are so many snacks around me? Let's take another situation. We are attending a family dinner and your favorite food is served and there are tons of cakes and dessert. Well, you realize that there is no right or wrong way to handle these situations, but there are just choices and consequences. You can eat smaller portions. You can avoid second. Obviously, avoid sweet food and high-fat food or alcohol. But some ways to plan ahead, maybe you can offer to bring a dessert or a dish that fits your way of eating. So how about preventing lapses? Well, avoid known triggers that can lead to a lapse. Triggers include people or places. Avoid passing by the bakery in the supermarket. But also have a plan B. You can remind yourself of a behavior after previous lapse along with the negative feelings associated with that behavior. And also you can remind yourself of a behavior after the last time you avoided a lapse along with the positive feeling associated with those behavior. But if you passed by the bakery and saw the yummy looking cake and brought some home and indulged and had a big piece, causing a big spike in your blood glucose, and how guilty you felt. But also remember the last time you resisted that before and how proud of yourself you felt. Getting over a lapse is a skill. Practice self-forgiveness. Avoid being harsh on yourself. Practice positive self-talk. Focus on what you can get out of the situation and avoid similar ones in the future. Focus your energy on getting back on track. Skills number 4. Obtaining support skills. It's very important. Support is extremely important in managing diabetes. This is why Diabetes Care and Education Support Programs, DSMES, is very helpful. Asking for support is not a sign of weakness. Rather, it's a sign of strength. Who can you call on to help you when you slip up and get back on track? Let's talk about family. What support do you get from your family in managing your diabetes? Does anyone in the family do anything that hinders your ability to manage your diabetes? How does diabetes affect your relationship with your family? Diabetes affects the whole family. If you have diabetes, your whole family and friends are affected. You should start with identifying the feelings of family. We talked about feelings that you have for your diabetes, but your family will also experience a different range of feelings. Let me explain. Genetics. We know that genetics play a role in diabetes, but no one should feel guilty about passing on the tendency to develop diabetes. Fear. It's normal for a family to be fearful when one member develops diabetes, worrying about what possible complication could develop for this member, or even worry about what to do if this person has an episode of hypoglycemia. Also, sometimes family have unrealistic expectation that a person should perfectly always manage their diabetes. Following healthy eating and exercise, and they use blood glucose reading as a measure to reflect on that person's ability to do so. But even when someone follows a diabetes plan very carefully, blood glucose levels don't always respond as we would expect. It's important to avoid power struggle. We all care about our family, and we want them to make the right decisions. And sometimes when they don't seem to make a good choice, we tend to intervene. Our interaction sometimes comes out as being pushy. Example, if you're having lunch with your wife and she may say you don't need to eat another slice of pizza, it will raise your blood sugar too high. You may proceed to eat the whole thing to show her who is the boss. You should ask for support from family. It's important to see positive support from the family. To use the I statement as we mentioned. I feel annoyed when you say I should not eat that. And instead of you make me annoyed when you tell me I should not eat this. It's an invitation for a conflict. Step number 2, acknowledge the family concern. They care about you. I know you care about me when you say I should not eat this or that, but I feel annoyed when you do that. Communicate what's best work for you. I know you care about me when you say I should not eat this or that, but I feel annoyed when you do that. It would help me if you just say, Are you sure? Other ways for family support: eating healthy together, exercising together, noticing the positive rather than the negative. We talked about support from family, but we wanted to make sure that you are asking for support from your healthcare providers. It's very important to be engaged in your care, but sometimes when you go to your doctor appointment, your mind goes blank and you forget what you wanted to discuss with your doctor. You need to sit down, write things down, anything you want to discuss, such as whether can I have a depression screening test. Speak up and don't wait until the end of the appointment. If you have problems following your care plan, let your doctor know and don't pretend that everything is going okay. If you don't understand any medical term, ask. If you do not understand the reason for a certain drug or a certain test, ask. Common concern sometimes that there's no time or my doctor doesn't listen to me. Diabetes is best approached as a team effort with professional input from your doctor, your pharmacist, your dietitian, but you are the center of this circle. You know best what best works for you. And sometimes it's about better approach and communication. But if it's not working, you may need to change the provider. But you are the one to determine so. Visit diabetes websites.
The Defeat Diabetes Foundation is a great research tool that helps you find a support group near you. It is not a support group in itself, but guides you to find a local support group near you. So you can find where area that you live in, say that you live in Texas, and then that will give you a list of examples available around you. Beyond Type 2, it is a free online community that have great information about Type 2 diabetes and a great support groups as well too. You will need to sign up for an account and wait for the account to be approved. Diabetes Daily, also a great forum with great information about different types of diabetes and support group. Diabetes Sisters are these resources for women only, but have great services like Diabetes Sister meetups. Also RX Assist, which is a great tool because it gives you a great information about medication. It is an updated directory of all the assistance programs in the US. And these assistance programs are run by the pharmaceutical companies to provide free medications to people who cannot afford to buy their meds. So you come to their website over here and say that if you don't have insurance coverage or you need assistance, you can type, say, Farxiga. And once you click on the link, that will take you to the website of the manufacturer. And then once you follow the links, it will take you exactly to the steps that you'll need to follow in order to get your medications and assistance approved.
Skill number 5, stress management. What is stress? Situations or events that cause emotional and physical response are called stressors and could be negative, like the lack of financial security, family issues. Could be positive, like a new baby, marriage, moving. And there are minor situations as well too, like traffic jam, holiday time. Emotional response or physical response to these stressors are called stress. We all experience stress, but too much stress or long, intense physical response to the stress could cause health issues and can affect your blood sugar. When you are in a very stressful situation, you feel nervous and sweaty, your heart is racing. It's the fight or flight response. Your body secretes stress hormones such as glucagon, norepinephrine, and cortisol. These hormones raise your blood glucose, your blood pressure, and your heart rate to fight off the stress or run away from it. Emotional symptoms of the unrelieved stress can include anxiety, anger, irritability, trouble concentrating. Physical symptoms also could include having headache, trouble sleeping, tired, high blood pressure, being very nervous, ulcers. Diabetes is both a physical and emotional stressor. For a person without diabetes in a stressful situation, when blood glucose goes up, the pancreas can make more insulin to bring the blood glucose to normal range. If you have diabetes, your pancreas may not be able to make more insulin, and your blood glucose level may continue to be elevated for a while. So how to manage stress? Until we can eliminate diabetes, which we can, Now, we need to learn how to cope with it. We all deal with stress differently. What is your way of dealing with diabetes distress? Be aware of any counterproductive ways you currently use to deal with stress, such as smoking, overeating, alcohol. But if your strategies work otherwise, perfect. Continue doing what you're doing. But if it's not working, you may consider trying the following. Number 1, engaging in regular physical activity, walking, hiking, swimming, whatever you enjoy doing. During physical activity, your body produces endorphins, feel-good hormone, that will counteract the stress hormone. Take a break. Even short breaks away from stressors can help. Number 3, eat healthy. Healthy food can help fight off the negative impact of stress. Number 4, get enough sleep. Just make the environment sleep friendly. Turn off the TV. Number 5, reach out to support system, as we mentioned. Talking to people about stress and asking for help is one way to de-stress. Number 6, practice mindful and deep breathing. Number 7, just indulge in your hobbies, whether it's watching a comedy or reading a book. Number 8, use positive affirmations. Affirmations are positive statements that are repeated over and over again. Use thoughts that affirm how you want yourself to be. I'm capable of change. I handle stress well. It works. Say it out loud with feelings while looking at yourself in the mirror. Write them down. Put them on papers. Put them in the fridge, everywhere that you can see them. And take an inventory of the stressors in your life, such as everyday demand of your jobs, your family. If you have any diabetes-related stress, you're not meeting your goals in diabetes, and pick one of these stressors and understand what are the triggers and how can you cope with it. Create yourself one iSmart goal. If you can do that 30 minutes of brisk walking a day for 5 days that your doctor recommended and that's causing you distress because you cannot do it, try setting a goal for yourself that's iSmart. Important or inspiring, specific, what will you do, where will you do it, and when? I will start walking after dinner around the block. Measurable. How much will you do it and how often? Well, I'll do 15 minutes 3 times a week. Achievable. What are the barriers and how to overcome them? If I feel lazy, I will ask my wife to join me. Relevant. How will this help you? That will make your blood sugar be really good after dinner. Time specific. How long will you do that for? I will do that for the next month, then I may do more the following month. I hope this information was very helpful for you. Please work on your iSmart goal and come back and let us know how did it work for you.